Hi, welcome to this beautiful morning. My name is Karis, and today we're going to be talking about choking hazards and preventatives.
My name is Faith. Today we will be talking to a registered nurse about choking hazards and pica and just some ways that you can try to prevent these.
Okay, so let's get started. Can you please state your name, what you do?
Hi, my name is Jasmine, and I'm a bachelor's prepared registered nurse.
I just want to say thank you for talking to us today, taking your time out of your day to just talk to us. It means a lot to me and probably our viewers.
You're very welcome.
So what are some things that your job entitles?
A registered nurse is licensed to save lives, so we can work in a multitude of places, the hospital, the nursing homes, in schools, and we can pass medications, conduct CPR, and anything else that a physician writes an order for.
Thank you.
You're welcome.
Have you ever worked with a client that has pica?
Yes, as a matter of fact, I have.
Okay, how is it like to work with a client that's pica?
It can be very strange working with a client with pica due to the fact that they crave objects that had no nutritional value to our lives.
So, can you identify the capacity in which your profession carries out treatment for pica?
When a client comes in and they present as if they have pica, such as craving ice or craving dirt, anything with no nutritional value, the physician does a thorough assessment and they may write an order, such as obtaining blood work, so that we can determine where the deficiency occurs. So say it was vitamin D, the doctor will write a prescription for vitamin D, and it is up to the patient to obtain that prescription. If the physician orders anything else, then the nurse is to carry that out.
Okay.
Have you ever been in a situation where somebody has been choking?
Yes, I have.
If so, what did you have to do? How was the situation?
Well, in my particular instance, and due to HIPAA rights, I will not state any company names nor will I state any of the patient's names. But in the particular case that I was in when a client was choking, I assessed the situation, determined that the client was, a matter of fact, getting ready to turn blue. And so airway is the most important factor. So I assessed the patient, determined if the object could be seen. If the object can be seen, you can easily do a finger swipe and remove the object. If the object cannot be seen, you do not want to try to do a finger swipe because you could further lodge the object into the client's throat, promoting more choking. So as I was assessing the patient, I'm also calling my other team members in because it takes a multifaceted approach, and at the same time making sure airway, breathing, and circulation are thoroughly intact at the same time.
So were there environmental preventatives that the individual could use to reduce the chance of choking hazards?
To reduce the risk of choking hazards, you could remove small objects from the room, especially if you have infants in the room or small dogs in the room as well, or any size dog or a disabled child that may not know to stay away from small objects that they may want to place in their mouth that could risk choking.
So, what advice could you tell our viewers on how to make their environment choke hazard free?
I would recommend to stay up to date with what's in the news to avoid choking hazards. Also, to remove small objects from the floors, to actually read the packages as well on the toy packages that they purchase for their children, because usually there's a safety hazard on there suggesting what age group it's appropriate for.
Okay.
Do you think that bringing awareness of choking hazard safety to the public would help protect individuals and animals?
Of course, I think anything that's a safety hazard, we should always bring to the attention of the public so that everyone is aware of the same things so that we can reduce the risk as much as possible.
Okay.
Is there any additional advice that you would like to give our viewers that are watching?
Oh, I can think of a few things. Number one would be if you do take care of someone in the home that cannot speak for themselves or they may be bed bound and non-ambulatory, I would suggest sitting them up in high Fowler's position, as Karis is right now, and feeding them, such as make sure they are not tilted all the way back. That would cause them to choke. That would be a choking hazard. Also, make sure their neck is not tilted too far forward down. Sorry, Karis, because that could also be a choking hazard. So make sure their head is straight up, back is straight up as well.
Okay. So we would like to thank you for joining us here today and talking to us about pica and choking hazards and how to prevent them.
You're so welcome. Thank you for having me.
You're welcome.
Thank you guys for listening, and I hope you got some advice of all our information today.
Thank you.